Weight loss surgery can be a life-changing experience, not only affecting the way a person looks, but also how that person feels. I'm talking now with Mark Ryan, who had that surgery more than a year ago, and you told me before we started that you wish you had done it sooner.
I did, Belonda. I had a great experience with bariatric weight loss surgery. I have reduced a lot of medicine that I was taking. Definitely, obviously lost a lot of weight. Lost over 80 pounds in a year, and it's been great for me.
So tell me about your health. You were taking all kinds of different pills, and immediately you could stop some of that.
I was on 7 different medications,
wow.
And the day after surgery, I was no longer on medication.
You've been able to get active.
Oh, yes.
And you've also been able to improve your diet. You've changed the way you eat.
Healthy proteins and healthy vegetables and fruits.
So tell me about the support you've gotten from your doctors and the staff here at First Health.
Dr. Washington, Dr. Grantham have been great, and their whole staff at First Health have been great. They don't just do the surgery and leave you. They stay with you for a year and on into the future.
Well, you look fantastic.
Thank you. Thank you. I feel that way.
Dr. Ray Washington performed Mark's surgery. Dr. Washington, what specific type of bariatric surgery did Mark have?
Mark had what we call the gastric sleeve. And the sleeve is where we remove 80 to 85% of the stomach, making it a tubular structure, much like the shape of a banana.
Okay.
And we've been very successful with that, being able to alleviate a lot of medical problems.
So you counsel patients, I would presume, to determine which type of bariatric surgery is right for them?
Absolutely. Depending on the patient's body habitus, medical problems, and coexisting previous surgeries determines which procedure the patient may be eligible for.
There are so many benefits, aren't there, for patients to drop that weight? For example, Mark telling us how he was able to just drop medicine altogether right away.
It's really spectacular. There's really a lot of metabolic things that happen right away. So a lot of our patients on oral medicines for diabetes are off of those medicines even prior to leaving the hospital.
And one of the great things that Mark was telling us about is that you don't just perform the surgery and say, see you later. It's a long-lasting relationship.
Absolutely. For our program, once you're a patient for life. And we think the key to our program is the multidisciplinary approach. So we have a nutritionist, we have exercise physiologists, as well as our nursing staff. And so we try to cater to our patients in each and every avenue. Most patients for the gastric bypass are in for about 48 hours. For the sleeve, about 24 hours, as well as with the band. And in about 2 weeks, most of our sleeve and band patients are ready to go back to work, and the bypass just a little bit longer.
All right, well, Dr. Washington, thank you so much. This is great information.
Thank you for having me.
You can learn more by visiting the website. You can find First Health at firsthealth.org.